the others are doing. You appear to me to be a man of integrity with some noble goals. I'm not sure there's enough others in Washington to go along with you. If I was going to go based only on my feelings, I would choose to do what I would think would be the compassionate thing and say, give everybody health insurance in the nation. If, however, I evaluate it in additional ways, and I use reason, history, and examples, and I look at the way Medicaid, Medicare, and the VA have run and are failing, and I look at the other countries, I hear that health insurance is imploding in Canada.
Here goes the noise machine. Here goes the noise machine.
Then I find myself wondering, how can this federal government that is so inefficient in so many other ways possibly succeed? And I do agree, lots of changes are absolutely necessary. I just think that trying to nationalize it all is the wrong decision because it's failed so many other places.
Not nationalization. There would still be a slightly regulated, which is now not regulated, private health.
No, Wall Street needs their money. Wall Street needs their money. Come on.
And I'll speak and try to address this. We have, if you can access it, we have the best quality health care in the world. There's no question about it. Beyond those who are uninsured who can't regularly access it. They have exclusions in their policies, they have lifetime limits, they have pre-existing conditions that are included. There's a host of problems. So maybe there's some agreement on reforming the existing system and giving people access and then providing some affordable ways for other people to get insurance to get into it. I would not say that Medicare has been a huge failure. Before Medicare went into effect, 23% of the seniors in America live below the poverty level, mostly because of the cost of their medical care. You know, today that poverty rate is less than 12%. And I would credit Medicare for doing a lot of that. It has its problems, I said it needs some work. And that work needs to be done to put it on a more stable footing, make it more sustainable, and improve the services that seniors get. The VA, I know a number of vets who are pretty happy with their care. I know a number of other vets who are not so happy, and I know some vets are pretty disgruntled. The VA system was neglected for some period of time. It really was. And we failed to anticipate that, particularly when we got into another conflict, both Afghanistan and then a big conflict in Iraq, that was going to create more veterans who needed services. And until that point in time, the VA budget, the President had proposed that the VA budget actually be reduced. And Congress started fighting back a little bit, and now we're putting the VA should be just mandatory spending. We figure out what we need to meet our obligations to our veterans and provide them care. We wouldn't have so much trouble recruiting docs and nurses into the system. They've been going hand to mouth year to year, you know, and what happens is, you know, gee, well, we'd like to hire you now, but what about next year? Well, we don't know about it. So this year, for the first time, we've passed a 2-year budget. I would like to do more than 2 years, but that's an improvement over the annual budget. So the VA can at least look at it and have a $3 billion increase. So I admit that system needs work too. And we're working on it, but actually the VA does too. They've pioneered some telemedicine and some other things that are incredible. They've been making do with a pretty crummy budget and actually doing some fairly interesting things, providing good services to vets there, but yes, it does need to be improved. So I wouldn't quite disregard it in that manner. So the gentleman next to you had a question too, and I don't know, or someone Oh, we're up back, and then we'll come, you had your hand up too, I think. So you had go ahead.
Hi, Congressman DeFazio. Thank you for coming on again. I just have a statement, and that is that I want single-payer health plans, and I think that a country that has health care makes for a very healthy country.
She's up there.
Okay.
When are people going to figure out that single payer isn't on the table anymore? That died weeks ago.
Cover that.